I will start by saying that the issues of malnutrition has become a global crisis, and it remains one of the most significant public health challenge in our time that is affecting over 800 million people, particularly in the developing countries. The issue is more complex, issue that is rooted in poverty, a lack of access to nutritious food, and inadequate sanitation and healthcare. Particularly in the northeast of Nigeria, it continues to adversely affect the health and well-being of people of the region, especially women and children. By children, we're talking about children under 5 years. And addressing malnutrition requires a comprehensive and a multi-sectoral approach involving relevant stakeholders, encompassing nutrition interventions, food security, economic development, and social protection. Once again, I'll say welcome everybody, wherever you're watching us from. My name is Kevin Alufe. I'll be your host for this event. This is the second edition of our learning series, courtesy of the Feed the Future Nigeria Rural Resilience Activity, funded by the United States Agency for International Development. This activity is implemented by Mexico, Save the Children, and IFDC. And like we had always said, that this is a series. We had the last series that had to look at some significant improvement and achievement as a result of what the activity has been able to do in the livestock sector, specifically in the northeast of Nigeria. Today, we'll be looking at the nutrition intervention, how also the activity has been able to use the different approaches to achieve the feats they are achieving within the nutrition intervention in the northeast of Nigeria. As you've all seen, the topic as it has been shared over different platforms on LinkedIn and also on different social media platforms, we're looking at rethinking the nutrition intervention, bridging the existing gaps. This promises to be a conversation. I have colleagues with me who are going to do justice to this topic, and I believe in their expertise because these are colleagues who have on the ground experience implementing nutrition intervention, coming from and also working in crisis settings. And it will be very interesting to hear their own side, how they were able to navigate some of the deep-rooted challenges within the Northeast, looking at the case study of Northeast and how they were able to come out with very tangible results, which they will be reeling out today. So I will not say on the hot seat, they are my colleagues. One is Deborah Obise, who is the nutrition coordinator for the Rural Resilience Activity. And also we have Benjamin Bivan, who is also the nutrition officer working on the same activity. Both of them have been doing well in trying to reduce issues of malnutrition using different strategic approaches in resolving this. So I will start with Debbie. Can you give us some overview and the context of what nutrition is? If you can take it at the Northeast level, it's fine. If you can take it globally, it's also fine. But just can you give us that context so that we start from there? Thank you.
Thank you again, Kelvin. Good afternoon, everyone who is joining. So I would be specific to the context in the Northeast and speaking specifically to states, Borno State, Adamawa, Gombe, and Yobe states. At the last survey that was conducted, we have over 9 900,000 children that are malnourished. And out of the 900,000 children, we have about 37% that are stunted and about 7% are wasting. Some of the problems that is facing the Northeast that leads to this increase in malnutrition are limited access to nutritious food, oftentimes due to the high prices of these foods and also low income levels of most of these communities. Some of the problems also has to do with inadequate agricultural practices, and these practices lead to low crop yield. And we also have a very high post-harvest loss in the Northeast, and this has further contributed to food insecurity and malnutrition in the Northeast. The Northeast has also suffered insecurity, and this has led to displacement of persons, and has also hampered farming activities in some locations, coupled with climate change that has disrupted food production, distribution, and systems. And one other factor is the insufficient healthcare infrastructure. Most of the health facilities lack essential health services and also have limited or inadequate awareness for proper nutrition. And these essential items are majorly needed by women and children, and because of limited access, they are oftentimes unable to take care of themselves, and there's an increase in malnutrition, both for mothers, but especially for children in the Northeast. So as an intervention or as a project, what we have looked into doing is looking at the problems and working with some of the available systems on the ground to strengthen some of the gaps we have identified. One of the gaps we identified has to do with agricultural practice. We worked with different seed companies to ensure multiplication of seeds at community level. We also promoted the use of biofortified seeds. And these biofortified seeds over time have supported farmers to increase their production and productivity, hence increasing the available food consumed at home and also at commercial level. We've also worked with different private sector partners to support the production of nutritious foods and also ensure that it is being distributed at household level and to vulnerable groups, especially to the last mile at the community level. To also bridge the gap in terms of nutrition access for food, we've also worked with mother support groups, supported them with trainings on perma gardening, vegetable gardening, backyard gardening. But also what we did was to look at it from a commercial angle. So not just food for consumption, but also to provide some sort of funds so they're able to sell the excess from what they've planted to be able to use those income generated to bridge the gap for other factors that increases the vulnerability of the households to access nutritious products, hygiene, and healthcare. As an activity, we've also supported the back-end of raw materials for processing ready-to-use therapeutic food. Before now, we had most of these RUTF partners or companies source their raw materials from outside of the country, hence increasing the cost of RUTF. But what we've been able to do is to facilitate access to these companies to uptake peanuts from the northeast of Nigeria. We've been able to facilitate about 11,300 tons of granules, and this has been supplied to food companies that are into RUTF production and RUSF production. One other intervention we've been able to carry out to increase the knowledge gap at community level is targeting men and women, especially women of childbearing age, with key nutrition messaging around exclusive breastfeeding for children under 6 months, complementary feeding for children above 6 months, and also supported communities with cooking demonstration. One of the things we found out was some of these communities have the necessary foods locally available, but they had issues with combining these foods. So what we did was to conduct cooking demonstration to help teach how to combine some of these nutritious foods to get maximum benefits from the locally produced foods they have. We also facilitated mass availability of nutrient-dense foods for the poor, working with private sector partners, food processors, who, for some, we encouraged resizing of some of their food products to make it affordable for some of those households to be able to use for their children to improve their nutrition. To further also improve the access to safe and nutritious food in the Northeast, we trained about 20,000 plus food processors on good agronomic practice, good manufacturing practice, labeling, food safety, and we did this with the support of the regulatory agencies to ensure that the food products that are being taken out are of global standard. And finally, we supported the Federal Ministry of Health with the updating of the Mother, Infant, and Young Child Nutrition Manual to increase awareness at health facilities, and also to include things like cooking demonstrations at facility level. And this is to ensure that there is an increased knowledge shared amongst not just the implementing partners, but also at community level. So when women access health facilities, they are able to interact with health workers who are trained on the MySyn program.
That is the loaded information you've given, giving us contextual insight of what the malnutrition status is in the Northeast. Bivan, before I come to you, if you have something to add to what Debbie has just said, this is also to say to our viewers, our participants who are joining us from different platforms within and outside Nigeria. Please, I know some of us might be itchy to ask questions. You can drop your questions on whatever platform you are, either on our LinkedIn page or the team link. The team will do well to respond to them immediately after this session. Thank you. Bivan, you have listened carefully to Debbie, and she has reeled out some statistics with respect to the status of malnutrition, and also looking at some activities or what you guys did in the Northeast. Do you have anything to add, just in 1 minute? Do you have any other point to add to what Debbie has just said? Thank you.
Okay. Good afternoon, everyone, and thank you, Kevin, for the opportunity to contribute to issues of malnutrition, addressing malnutrition in the Northeast. I would say David has done justice to the context, and what I would just add is one of the things we also did was to support the Federal Ministry of Agric to develop the core principles for extension practices in Nigeria, where we also provide technical support on nutrition sensitive agricultural approaches, whereby agric extension workers will be supporting farmers in being intentional in terms of the kind of crops they cultivate that will also help in meeting household nutritional needs to ensure that households are consuming diverse crops. They will help provide the needed nutrient that the household needs for survival and to improve the household outcomes. A part of that, I will also add that we are intentional in terms of working with women. We were able to build capacity of women to ensure that women have the capacity to process some of these locally available food to meet the household nutritional needs. Thank you, and over.
Yeah, thank you, Bivan. That's a good. You really amplified what Debbie has just read out. So, Debbie, I think this question should go to you. You've mentioned very key cases of malnutrition. I know when you came into the Northeast, like I said in my intro, you came into a region that has been plagued by long-term period of insurgency, and also different crises that has bedeviled the region. Um, Specifically for nutrition and how well you have been working within this sector, do you think, from what you've said, do you think you are really addressing the root causes of malnutrition? I know you might understand what I'm saying, because uh, there are a lot of factors from what you said that leads to malnutrition. Do you think you have been able to address those root causes? Thank you.
Yeah, thank you, Kevin. So for malnutrition, oftentimes has implementing partners, we often focused on short-term solutions rather than long-term systemic changes. And systemic changes, changes that addresses root cause of some of the factors that lead to malnutrition. What we've been able to do as an intervention is to look at working with diverse group of people. We've looked at addressing malnutrition as a multi-sectoral thing. We have not streamlined it to just maybe a health problem, but rather we've looked at it from a holistic angle. So we did not just focus on providing food aid, for instance, or just nutrition supplements, but we looked at some of the systemic issues, for instance, access to health care. Information was a major problem, especially at the rural communities. Limited or inadequate infrastructure are some of these underlying factors that increase food insecurity. And what we did was to work to ensure that there's a coordination between different sectors. Fortunately for us in the Northeast, we have, in all of the states of implementation, we have the State Coordination for Food and Nutrition. This unit is seated with the Ministry for Budget and Planning at the state level. We also have another one at the federal level. And at the state level, we work with different MDAs to tackle the issue of malnutrition. And what we basically do is to look at the different areas that different partners are working on. For instance, at the state level, we have the Federal Ministry of Agric that are into agricultural related activities. So working with extension workers to provide extension services to rural farmers on good agronomic practices, new innovations, and also to provide certain support, maybe when the plants have issues and all. Then we also work with the Ministry of Environment, the Ministry of Environment to tackle issues around wash, looking at their source of water, looking at the cleanliness of the environment, and also the disposal methods adopted by different communities. We also have the budget and planning also being in charge of spearheading advocacy, especially to the governor, on different areas that has been highlighted and attention needs to be given.
Are there other factors you think that even doing your work in the Northeast or by that you've noticed among people intervening within the development sector with respect to malnutrition, things that you think that they are overlooking with respect to addressing malnutrition? Thank you.
Thank you, Kevin, for that questions. Yes, as development practitioners, one key thing I noticed in terms of program design for nutrition, and one thing that has been consistent is issues of addressing the immediate causes of malnutrition, and to some extent we don't usually pay more attention to long-term solutions to addressing malnutrition. And so much focus is on nutrition specific kind of intervention that tend to address issues of treatment, and less investment or is placed on issues of long-term solution to addressing malnutrition. And so and I think our focus should also adequate attention should be tailored toward addressing long-term solutions that will address issues of malnutrition. For example, not much attention has been paid in terms of coordination between the government, the NGOs, and private sector players that are into food processing and co. So there is no much incentives to food processors, and I don't think there is any, especially the ones at state and local government level, the ones, maybe some of the women that are into food processing, that find it difficult to assess or register their products because of the cost implication in terms of registered product with NAFDAC, with the Standard Organization of Nigeria. So there is not much incentives to ensure that these products are commercialized to be accessed by rural households, especially the vulnerable households. And I'll give you an example of a particular private sector player whom we are currently working with. During our engagement, one thing that was very clear was that as a market actor, as a business owner, whatever you want to do is to ensure that you are able to break even so that you continue to be active in the market. And so less attention is given to who access your product. And so if there's adequate coordination, incentives will be provided so that these market actors should be able to also be targeting vulnerable households so that issues of malnutrition will be addressed. Let me give an insight. This market actor, during our conversation, we were meant to understand is only targeting supermarkets, big shopping malls to market their products. And so and one of the insight he provided was that poor people cannot afford some of his product, and so it was better for him to target big supermarkets. So this is some of the realities on ground that exclude vulnerable households from accessing some of these nutrient dense food products. And so what we are able to do was to provide an incentive to say, okay, can you test run to see whether it is because of the packaging of your or the sizing of your product that make it unaccessible to the rural poor. And so and one of the feedback is that after resizing, in fact, it has drastically increased his market share for his product. So there is need for these incentives for food producers, food processors to be able to also target the vulnerable groups to ensure that we address issues of malnutrition. And another thing is not adequate attention has also been paid in terms of nutrition sensitive agriculture approaches that tend to provide capacity information to farmers to ensure that they are more intentional in terms of making decisions on the kind of crops they cultivate to also meet up with their household nutritional needs. And so and one of the things is that program implementers, government, NGOs need to also begin to pay more attention in terms of investing more in ensuring that household or farmers are empowered to make intentional decisions on the kind of crops they cultivate that will meet household nutritional needs. And then another thing I think we are not also paying more attention to is empowerment to women and youth. Poverty is one of the driving force for issues of malnutrition, and especially also in the Northeast. And so not much investment is going to empowering women and youth. And so there is need for us to really be intentional in terms of empowering women and youth. As they earn income, part of those income, it is our belief that we'll go back to the household in terms of food consumption that will help in diversifying the nutrient intake for households. And then another thing I think we are not really also paying much attention to as institutions and organizations are implementing partners is involving working, engaging community to identify locally available foods and then help them or support them identify the nutrient composition of those groups so that they will appreciate these crops and then begin to consume them. An average rural poor will appreciate noodles compared to consuming maybe green vegetables because of the kind of impression that he has. Like this noodles is is a product, is a sport product. Meanwhile, he has or they have locally available crops that are more nutrient, that have more nutrient, that could add more nutritional value to their household meals instead of spending their little resources on consuming noodles that may not add much nutritional value. So how can we work with communities to map out the locally available crops and then identify the nutritional content of these crops and then sensitize community to appreciate some of these food crops so that we help improve their consumption at the community level. So these are some of the things I think as programs, as institutions, we need to also begin to focus more on. Thank you, Anova.
Thank you very much, Bivan. You've touched on very something that also sits at a very strategic point, not only for the Northeast. You mentioned something about identifying locally nutritious food, and Debbie also alluded to that point also, which you think that industry players, implementers are not also paying attention to that there are foods within the domains of where those vulnerable populations are, where you have issues of malnutrition that can also help address issues of malnutrition. Thank you so very much. Before Debbie, I'm coming to you shortly. Before I get there, this is also to say to our participants that I know you are also interested in asking questions, but we don't have opportunity for that, but you can drop them on whatever platform you are watching us from. Like I said earlier in my opener, my colleagues who are on this panel will also respond to those questions as they come in. Yes, Debbie, you wanted to land on your point around addressing the issues of malnutrition. Can you land on that point? That's one. Then secondly, you've started talking around coordination. So you can give us more insight into the kind of collaboration that can happen across the stakeholders that can also impact on mitigating malnutrition. Not only you are giving us contextual insight for the Northeast, but I want you to give us a broader collaboration that you think can work, and also industry layers you can also learn and take a cue from. Thank you.
Okay, thank you, Kevin. So my final point on my earlier point is that while we've made progress in addressing food and nutrition insecurity, we need to do more work in tackling the root causes of this issue, and it will require a shift towards a more holistic and sustainable approach that will address not just the top view of the nutritious issues, but the underlying systemic factors. And this has a lot to do with how we collaborate among different stakeholders and different partners. Now, talking about collaboration on nutrition, tackling malnutrition, the issue of collaboration cannot be overemphasized. Collaboration among NGOs, private sector partners, and government agencies is very essential, majorly to reduce duplication of efforts and also to have a holistic approach to addressing the nutrition challenges. And some of the ways we can collaborate is to have joint planning or coordination meetings, have joint resource mobilization, and also ensuring that we do a lot of monitoring and evaluation to ensure that the impact and sustainability that we're working towards is maximized, especially monitoring of some of these interventions. For some of the health facilities, we've had women complain about having to buy some of these nutritious products that should be free for severely malnourished children. Overall, tackling food and nutrition insecurity in Nigeria will require a comprehensive shift and provide multisectoral strategies that will address the root problem. I think if we have that level of coordination and collaboration, it will be easier to tackle the nutrition issues, be it policy level issues, grassroots levels. If there's that level of collaboration, I think it will do a lot of good to help address malnutrition issues. Thank you.
Yeah, thank you. Thank you. You've really I know I want to follow, but I think I'll push that question to Bivan. Debbie talked around joint planning, joint resource mobilization, and also joint monitoring and evaluation. For you, Debbie has given us like somewhat an ideal what an ideal collaboration should look like. So give me insights. How did this work for you while you were intervening, looking at this different stakeholders you worked with? Then also letting us know what was the experience in doing this and what results came out of such kind of collaboration. Thank you.
Okay. In terms of collaboration, I'm also bringing this to the notice of our viewers that for our interventions, we didn't have any focus in terms of treatment, but we are making referrals through nutrition screening using community structures like nutrition community volunteers who we are conducting malnutrition screening at community level. Since we are not doing any reference, so we are able to identify some facilities that are into nutrition treatment, malnutrition treatment, and also identify stabilization centers that deal with issues of complications and the rest. So because of that relationship, so we're able to make referrals to these facilities for participants to access services. So that's one thing that collaboration can help you achieve at the community level. Also, we made mention of the issues regarding the high cost of ready-to-use therapeutic foods, and because of issues of the importation of key raw materials, and so currently, because of coordination, because of our collaboration with other key stakeholders, we're able to come up with a technical working group that will look at the key issues to ensure that we are able to ensure we have we begin to have access for these basic raw materials internally within country. And so issues of quality of groundnut, how can we help or work with farmers to ensure that we improve quality of groundnut, because one of the key complaints from some of the industry players and also regulators is the high cost, the high value of the high content of aflatoxin in our groundnuts. And so how can we verify some of these facts? And then how can we also work with farmers to ensure that we improve the quality of our groundnut? And so by so doing, currently we are working with some of the private partners. Last year, we were able to work with one of our partners to build a capacity of about 1,000 farmers on groundnut preparation using aflasafe to reduce the aflatoxin content in our groundnut. And also through collaboration and partnership, we are working with also market actors to use some of the modern day wearing or storing facilities to ensure that we reduce the moisture content of some of these products. So that is what one thing that collaboration can foster. Also, we are able to collaborate with the state government to develop their multi-sectoral plan of action for food and nutrition that will help address issues of malnutrition in the state. So by collaborating, you will be able to leverage some of your resources to achieve maximum result at community level to address issues of malnutrition. Thank you, Anova.
All right. Thank you. Thank you very much. I have 1 minute, and in 30 seconds each, what message do you have for industry players from the private sector, from the government, and also implementing partners, development organizations who are willing to go into a nutrition intervention? So that, like you said, I'm using your word, Debbie, you said there should be a shift to a more holistic and sustainable approach in addressing malnutrition. In 30 seconds, what's your message for them? Debbie, first.
Okay, so my message for industry players would be to look at tackling the root problems that are contributing to malnutrition issues than just working at the surface, and working with the community to understand what the issues, the nutrition issues are, and be willing to work with the structures available to address those nutritious issues. Thank you, and over.
All right. Thank you, Debbie. Bivan?
Okay, for me, for the private sector, I would say the Northeast market is still very on top. There are great opportunities for them to invest in the Northeast, and the Northeast is functional. There are functional markets, and there are opportunities for them to really make it big in the Northeast. And we have testimonies from some of the current partners we are working with, whom had doubt, but with conviction, they were able to invest in the Northeast, and some of them are even diversifying into other businesses. And to the government, I would say they should create that enabling environment for food processors, especially those that are providing nutritious food in the market, for them to be able to also target vulnerable groups to ensure that we address malnutrition. And for the NGOs, I would say as we implement, we should also be sensitive to other cultural issues, and also the cost of culture will determine the consumption, the food preferences of communities. So these are things that we need to be intentional and sensitive as we implement. Thank you, Anova.
Thank you very much, Deborah Obise and Bivan. Those are two very colleagues with nutritional professional fecundity, I must say. You guys have really done justice to this topic. And before we round off this second edition of our learning series, I would like to say that our participants to watch out also for the next learning series, which will be coming forth in the next 2 weeks. And we'll be looking at another intervention and what we're also learning from that. This is the size of the package for today, and we hope to share the next update with the last set of learning series that we'll have going forward. Thank you very much, everybody, for where you are watching from. Please, if you still have those questions, please drop them on, even though it's on our LinkedIn page, we'll have time to also respond to them. Once again, thank you, everybody, and to our panelists, thank you, and see you next time.
Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you so
Have a
much,
good
Debbie and
evening.
Bivan. All right.